Hi everyone, my name's Chris Williams. I'm a nurse in PICS. I work in regional outreach. I'm sorry I can't be there tonight. What my role involves in PICS is I provide education to nurses, allied health, to medical teams. We have 9 centres around regional Victoria, and I also provide education down in Tasmania with Launceston and the team in Royal Hobart. And so some of that can be quite varied. It could be sitting in the emergency department in Traralgon. It might be providing a procedural pain management course in Ballarat, or it could be doing some foundations training in Albury. I think it's really important that we actually provide education on site to these local teams, because I guess the philosophy of PICS is around providing safe care as close to home as possible. And to provide that safely, we need to enable these teams to be able to do that. And so our philosophy from day one has not been about us going out and doing things, but about facilitating and enabling people to actually provide that care themselves. And when we do that, it builds trust, it builds confidence, and it builds competence. Building trust and capacity is really important for the family. They need to know that when they go back to their local regional centre, to their service, their hospital, the people know what they're doing. They need to know that they're following the guidelines. And I think building that trust works in many ways. So it gives the cancer team the trust to actually share the care, to promote the care and feel confident to do it when they see that, and we promote that and we talk about that. And the impact there for families is a given. The idea is what we're trying to combat here is the tyranny of distance. And having a cancer diagnosis is always an incredible challenge for families and children. But to do that from 350 kilometres away is going to another level. And that access to the right people at the right time is so important to actually reduce that burden of travel. Having families that can just have local care, they can go home and see their family, re-engage with school. One of the things we do in education as well is a low complexity chemotherapy program. And we're doing that in 5, and now we're opening into our 6th regional centre in Victoria. And providing that education is again about getting local staff collaborating with their adult team and actually looking at how can we provide chemotherapy closer to home. And some great examples we've had over the years has been families that have been needing weekly IV chemo. It might go for as long as 68 weeks. And to be able to do that locally is just a phenomenal change. When you've got a 700K return journey and you have to do it every Friday for the next 68 weeks, the mindset of some families is very, very challenging. And what am I going to do and how am I going to achieve that? And to be able to say, well, that's the kind of chemo we can give locally is just like a game changer. So, you can't do that without the education, without the support, and being on site is critical. And doing it in their real time, it really engages a lot more people. So a good example of that was down in the Gippsland, where I was able to just sit in the trauma bay. I sat there all day and we got about 60 staff through, on accessing guidelines, managing fever and neutropenia. So I think it's being short and targeted and doing it right. And often that needs to be where the people are. Just like we're following where the patient lives, we're going to where the staff live too. So I think that's where I see the big build and the outcomes in local education being a real win. Advocate. If you're a parent, think about talking to your oncologist about your local care. If you're an oncologist, think about planning that local care. And we're very happy to open up to see how we meet the scope of practice in your regional centre.
Why did you apply for the PICS Nursing Fellowship?
Applied for the PICS Nursing Fellowship to learn all aspects of the paediatric oncology services, not just at Monash Children's, but what's offered at the Royal Children's and Peter MacCallum Cancer Centre, and also to gain a better knowledge and understanding of the paediatric oncology patient and the family's journey across the campuses and the different modalities and treatments offered.
What did you do as part of your fellowship?
I spent roughly a week at Peter MacCallum Cancer Centre and the remaining time at the Royal Children's Hospital, observing and shadowing different people across all areas of paediatric oncology at both campuses.
What were your 3 most valuable experiences?
time spent at Peter MacCallum Cancer Centre, working with the paediatric CNCs through the radiation area for our paediatric oncology patients, but also the adolescent and young adult area, which is called On Track there. I guess my second would have probably been working with the bone marrow transplant and CAR T CNCs at the Royal Children's Hospital, because we have such a shared care aspect with our patients at Monash that go over to the Royal Children's for transplant, that I found that amazing and really relevant to our patients, and gave me a better understanding of their journey and the care that we provide. And then I think my third most valuable experience would have been the time I spent in the flow cytometry lab at the Royal Children's, because I felt like that was a real behind the scenes look into cell therapy that many people don't get to experience. And I got to follow some patients from Monash who were over at the Royal Children's giving their cells in the apheresis space, and then follow them to the flow cytometry lab and see what happens.
How do you think the fellowship benefits patients and families?
Personally, I think it gave me a greater confidence and understanding to speak with families who may be asking questions about what their time at the Royal Children's or Peter MacCallum Cancer Centre for transplant and radiation might look like. And I think that would allow the families to be better prepared and more at ease with the process and transfer, if we as nurses can give them a little bit more information about what it's going to look like.
Following a successful placement, Alice will work on an improvement project for the Monash Children's Cancer Centre to complement the experience. Holly Wilson from the Royal Children's Hospital has started her nursing fellowship this week with PICS. We wish to express a big thank you to all the teams who have hosted and supported the PICS Nursing Fellowship this year.